আমার নাম হরিপদ ঘোষ। আমি ওয়েস্ট বেঙ্গল থেকে এসেছি। ওয়েস্ট বেঙ্গল উত্তর দিনাজপুর থেকে এসেছি চিকিৎসার জন্য। আমি প্রথমে এসেছিলাম দিল্লি এইমসে ছেলেকে নিয়ে। ওনাকে ফার্স্টে এইমসে নিয়ে যায়। এইমসে গিয়ে অনেক রকম রিপোর্ট করার পরে ওনার ক্যান্সার ধরা পড়ে, ব্রন ক্যান্সার। তারপরে ওখানে কেমো চলে, কেমো থেকে রেফার করে দেয় ডাক্তার অর্থোপেডিকের কাছে। অর্থোপেডিক ডাক্তারের কাছে যাওয়ার পরে এইমসের অর্থোপেডিক ডাক্তার বলে যে হাত কেটে দিতে হবে। তারপরে আমি বুদ্ধি পেয়ে আমি ব্যাঙ্গালোরে স্পার্শ হসপিটালে খোঁজ লাগাই। খোঁজ চালানোর পরে এখানে ডাক্তার আমাকে অ্যান্সার দেয় যে হাত বাঁচানো যাবে। আমি ব্যাঙ্গালোরে ইনফ্যান্ট্রি রোড স্পার্শ হসপিটাল আসি। এসে ডাক্তার সুরজ কুমারের কাছে আসি, অর্থোপেডিক। উনি আমাকে অনেক রকম রিপোর্ট করার পরে উনি আমাকে আশ্বাস দেয় যে হাত বাঁচানো যাবে। তারপরে গত 26 তারিখে অপারেশন হয়, হাত বেঁচে যায় এবং ছেলে এখন অবধি সুস্থ আছে বর্তমানে। ওনার ব্রন ক্যান্সার হয়েছিল হাতে, তো এইমসের ডাক্তার বলেছিল যে হাত কেটে দিতে হবে। তারপরে আমি স্পার্শ ইনফ্যান্ট্রি রোড ব্যাঙ্গালোর আসি, এসে এখানে সার্জারি করাই।
Hello everyone, I'm Dr. Suraj, an orthopedic oncology surgeon from SPARSH Hospitals, Bangalore. So I'm here to talk about a very challenging case which we did here at our hospital about a few weeks ago. So this young boy was from a remote village in West Bengal. He was diagnosed with a dreaded cancer of the bone. It is called as osteosarcoma. So unfortunately for the kid, the tumor was in the hand and it was growing at a rapid pace. He underwent a few surgeries which was ideally not supposed to be done, but unfortunately back then when he underwent those surgeries, it was not known that patient was having cancer. So after a couple of surgeries, patients had a big wound in his hand which kept increasing day by day. And that's when they came to know that it was actually cancer that was troubling the kid. So patient took chemotherapy for a few months in Delhi, because of which the cancer became small and it shrunk very well. So after that, he had to undergo a definitive surgery to remove the cancer from the body, because that's the only way of treating bone tumors. Chemotherapy will actually help us in shrinking the tumor, but the only definitive treatment is removing the cancer from the body. But unfortunately, because he had a huge mass and because he was not initially treated properly, he was advised an amputation where the entire hand had to be removed. This was definitely not acceptable both for the patient and for the parents, because the kid was just 7 years old. That's when he approached us asking us if we can do a surgery, remove the tumor in one single piece and also save the hand. So we got a lot of scans done. We discussed in our multidisciplinary tumor board, involved the reconstructive and plastic surgeons, and we came out with a solution. So using 3D printing technology, we got the 3D model printed. So this is basically how the patient's forearm looked. So this 3D printing helped us to understand how the cancer looked, what is the shape of the patient's hand, how are the blood vessels and how far are they from the tumor, what blood vessel we need to save, what blood vessel we can sacrifice, how to remove the tumor in one single piece. All these things were understood with the help of 3D printing technology. So this is how actually the patient's bone looked. If you can notice, this was the cancer and the hand has 2 bones. The forearm basically has 2 bones. One of them had cancer. So we had to remove this in one single piece. So even if we did remove this, we were left with this, which is basically an angulated or a crooked bone. So we also had an additional challenge where we had to straighten this bone. So that also we could do with the help of 3D printed cutting guides. So once we achieved correction and made the bone straight, this is how his forearm looked. But here you can notice that there is only one bone. In children, it's better to replace with another bone. So we had to take a bone from the leg, which is called as the fibula, and then transfer it to the forearm. So this would give the kid both the bones. The most challenging thing here was the reconstructive part, because we had to replace the bone in such a way that with time and with age, this bone which has been replaced in the forearm also grows. This is called as vascularized fibular epiphyseal transfer. So it's a very complex procedure and not many such procedures have been done in our country. So we could perform this with the help of our excellent plastic and reconstructive team. Unfortunately, the surgery went very well. So right now the wound have all healed. Patient is doing well. He's able to use his fingers, and maybe in a few more months we'll take out the cast and he'll be able to completely use his hand. Hopefully it will also grow like how we have planned, and hope that he has a bright future where he can get back to his activities, he can go back to school, and he should be able to hopefully perform all activities of daily living that he was used to before the diagnosis of cancer.
সার্জারি করে হাতও বেঁচে যায়, এখন বর্তমান সুস্থ আছে। হাতে একটা ব্যথা হয়েছিল, হাতের ঠিক উপরে কবজার উপরে একটা ফোড়া ভাব হয়েছিল, ওখান থেকে ক্যান্সার ছড়ায়। স্পার্শ হসপিটালের ডাক্তার সুরজ স্যার সার্জারি করেন, উনি খুবই ভালো ডাক্তার এবং খুব ভালোভাবে উনি সার্জারি করেছেন। এখন অবধি খুব ভালো রেজাল্ট আছে বাচ্চা বর্তমানে।